Heading to Europe, Pope Francis has suffered a breathing crisis on his 15th day in hospital with pneumonia. Let's go to our correspondent, Stash Butler, at the Vatican. Stash, how serious is his condition?
Well, it's certainly a setback after days of what the Vatican has said were improvements or at least stabilisations in the Pope's condition since he suffered a more serious breathing crisis on Saturday. Now, what we know is that the Pope spent the morning resting and doing physiotherapy to help him with his breathing. But then around the early afternoon, he suffered what they're calling an isolated crisis of bronchospasm, a kind of sudden tightening of the lungs, the muscles in the lungs, sometimes caused by bronchitis, also asthma. And then what followed, the Vatican says, was an episode of vomiting and inhalation, which led to a sudden worsening, in their words, of the respiratory picture. The Pope, according to the Vatican, was then put on non-invasive mechanical ventilation. Vatican stressing that throughout his treatment, the Pope was alert and responsive, but nonetheless that because of this crisis, his prognosis, the path really is going forward for him, still remains guarded. Now, that is not the news that people gather here at St. Peter's Square for the fifth night in a row to pray for the Pope's health, we've been wanting to hear. Earlier in the day today, the Vatican confirmed that the Pope would not be attending Ash Wednesday celebrations on this coming Wednesday, marking the beginning of the Christian period of Lent. So again, this is Pope Francis, an 88-year-old. It's 2 weeks since he arrived in Gemelli Hospital in northwestern Rome, and there's still no sign of when he's going to leave.
Thank you, Stash. We'll get back to you through the course of the morning, our time.